Good afternoon. I hereby call this the second meeting of the Early Childhood Education Task Force to order. As a reminder for everyone to please put your cell phones on silent. Turn them off if you want, but I think silent is probably what works for everybody's schedule right now. Mara, can you please call the roll?
Senator Schroeder, Senator Thomas, Senator Wilson,
Here.
Representative Bowling, Representative Raymond, Representative Sharp, Co-Chair Carroll,
Here.
Co-Chair Heverin.
Present. We do not have a quorum at this time, so we will not be able to approve minutes. So we will go ahead and we will approve minutes if we get a quorum by the end of the meeting. Does any members have any questions or recognitions they would like to make? Seeing none. For those here attending the second meeting, the setup looks a little different than our first meeting. As you can see, we've got some tables set up for some of our guests. These interested parties were actually mentioned in the concurrent resolution passed by the Senate, so that's why they are there. When the period comes for you all to comment, if you can please come to the table with the microphone, we would greatly appreciate it. So that, and just make sure to make contact with Mara or Ben or myself or Co-Chair Carroll to let us know if you want to talk, or you can text us and let us know that you would like to speak to come up to the table. We just want to make sure that everything is concise as possible and so everyone can hear, since they're not microphones. Another reason that we have microphones is so that people watching on KET can also hear. So make sure that when you are speaking, you hit the microphone button, which is on, that it will be green. So make sure whenever you're doing that so everyone can hear. As noted, last month, addressing the child care crisis in Kentucky is addressing the workforce shortages as well. To that end, we have asked for input from the business community and welcome individuals from the Kentucky Chamber of Commerce, Toyota Motor Manufacturing Kentucky, the Rockcastle Hospital Child Development Center, and the U.S. Chamber of Commerce to come forward to present. So if Charles, Sandy, Twyla, and Kuna would like to come up, that would be wonderful. And once you get settled, please introduce yourself for the record.
Charles All, Executive Director of the Kentucky Chamber Center for Policy and Research.
Kuna Tavalin, Senior Advisor to the U.S. Chamber of Commerce Foundation.
Twyla Burdett, Director of Rockcastle Hospital Child Development Center.
Good afternoon. I'm Sandy Knott. I'm the Vice President of Toyota Motor Manufacturing Kentucky in Georgetown, Kentucky.
Awesome. Please go ahead and get started, Charles.
Well, Co-Chair Heverin, Co-Chair Carroll, thank you both for having us here today. We certainly do appreciate the work of this task force and also the mission that you all have set out to accomplish. What we want to do here today is hit on a few different points. The way that this presentation is going to flow is that first I'm going to start out by simply framing the conversation and talking about why this issue is not only of interest to Kentucky's economy and Kentucky's business community, but is increasingly becoming one of the most pressing workforce issues facing our economy and facing the business community. After that, we're going to talk about some very specific examples of employer-led solutions in this space. We talk about things like on-site childcare, employer-provided childcare benefits. What I think is important, though, is that we get a sense of the reality of what that actually looks like. And so we have two guests here today that'll be able to really flesh out what it means to have an on-site childcare center and to be part of a business that is offering these direct childcare solutions, because I think the nuance of what that means is very important. We're also going to talk a little bit about the federal landscape for childcare policy and state efforts throughout the nation. So that'll be led by Kuna Tavalin with U.S. Chamber of Commerce Foundation, who can really speak to things that we're seeing broadly. And then finally, we will conclude with some specific policy recommendations from the Kentucky Chamber for this task force to consider. So I want to start by just jumping in and talking about, again, why this is such a critical issue to Kentucky's economy and to the Kentucky business community. I'm going to try to illustrate that by just looking at two quick charts. This first chart here gives you a sense of the number of job vacancies that are currently in Kentucky, as well as the number of individuals who are currently seeking employment in this state. So what you can look at here is that blue line. That blue line represents the number of job vacancies throughout the state. You can see kind of going back to January 2020, that was roughly down closer to less than 100,000. Throughout the course of the economic recovery from COVID-19, that has steadily increased. Based on the most recent data that we have, there's roughly 180,000 open jobs in this state. That comes down from an all-time high of north of 200,000 just in the preceding month. This is a very, very large number of open job vacancies throughout Kentucky. That red line represents our unemployment rate, or not unemployment rate, the number of unemployed individuals in Kentucky. You'll note that really big spike there after January of 2020. That's, of course, COVID. Nowadays, though, we're roughly in the range of around 70 to 80,000 individuals who are unemployed. It's important to remember how unemployment is defined. Unemployment means you're an individual without a job and you're actively seeking work. So these aren't people that are not seeking work. These are folks who want a job. What this chart means is that we're dealing with a situation where we have roughly 2 open jobs for every individual that is actively seeking work. That puts a really tight strain on your labor market and makes it very, very difficult for employers to hire. Typically, if we were to zoom back to pre-January 2020, you'd see a number where it's a little closer 1-to-1, roughly 1 open job for every individual that's out seeking employment. The point, though, that I'd want to make and really stress here is that this problem, as bad as it is for employers, is not necessarily new in Kentucky. Anybody that's sort of seen me give any sort of talk or dealt with labor force related issues has probably seen this chart. What you're looking at here is the United States workforce participation rate. That's the red line. Below that, the blue line is Kentucky's workforce participation rate. You can point out 2 distinct things when you look at these. First, a noticeable gap between the workforce participation rates between Kentucky and the United States. That is something that has been very consistent over time, generally about a 4-point difference between US rates of work for adults and Kentucky rates of work. The other noticeable decline or issue, though, is that downward trend line. The number of individuals that are actively participating in the workforce has been steadily declining ever since for really about the past 20 years or so. And there's no showing really any signs of that decreasing. Even though our economy has recovered, our labor market's recovered, we're still following that overall trend line of going downwards. Last year, the Kentucky Chamber released a report dissecting this issue, getting into some of the ins and outs. This was a report titled 20 Years in the Making, Kentucky's Workforce Crisis. We comb through all that data, but we also get into a lot of the root causes, things such as poor health outcomes, demographic change in the form primarily of retirements, but also slower population growth, lower immigration inflows, addiction, benefits cliffs, transportation, reentry issues, educational attainment issues, but of course childcare as well. And really what we want to hammer home here today is the significant stresses that the access to quality childcare for working families is placing on the ability of individuals to actively participate in the workforce. I do think that's a difficult thing to quantify, but it's important that we make some efforts to do that. There's a lot of good polling data that we can look at to get a sense of just how much issues related to accessing quality childcare or affording childcare could be potentially affecting the ability of individuals to work. This is just a quick sampling of that. The Bipartisan Polling Center, Policy Center polling has done some good research on this. 68% of respondents to a poll that they did, I believe in 2021, showed childcare affected one's individual to stay in the workforce. 66% noting childcare affected their ability to work more hours. 20% flat out said they had to quit a job due to stay at home with a child related issues such as accessing childcare. Kuna later might be able to mention some of the other polling that the U.S. Chamber Foundation has done in that area that shows similar data. Another resource we can look to, though, to kind of get more specific to Kentucky is a data set from the United States Census Bureau. Something they started doing during COVID is something called the Household Pulse Survey. It's a little bit of experimental data where they are asking folks who aren't working why they're not working and giving them a whole range of different options that they can select in terms of how they respond to that. So they can say things such as, I'm not working, or maybe I have someone at home who has an illness that would make them vulnerable to COVID. A whole range of different options are available to folks in this. But one of the options that people select is they're not working because of care for children not in school or daycare. Based on the most recent data, that was around 45 to 50,000 Kentuckians who are not able to work due to taking care of children who are not in school or not in daycare. To quantify that a little bit further, if we were to take that 45,000 people and remove those barriers for them and bring them into the workforce, that could increase our labor force participation rate by more than a full point. And to put that into context, it is very, very difficult to move a full point in your labor force participation. So being able to do that would be extraordinary. And I think that gives you a sense of the stresses that are being placed. With that, I really want to turn things over now to some of our experts to really walk through some of the nuances of what this means. And these folks have already introduced themselves, so I'm going to turn things over first to Sandy to kind of talk us through their program.
All right. Thanks, Charles, and really excited to share some of Toyota's activities with you today. As I mentioned, I am at the Toyota Motor Manufacturing Kentucky plant in Georgetown, Kentucky, home of 10,000 team members, and I should say very proud team members. And it is our largest plant in the world, so you can understand the significance of these types of programs. I'm also a native Kentuckian from Princeton, Kentucky, so I'm very proud of that, Western Kentucky. But thank you for allowing me to share our child care program with you today. We believe it's an important benefit for our team members' peace of mind when it comes to child care while working. Next slide, Charles. This is just a quick image of our Child Development Center. It was established in January 1993. And for those who remember Captain Kangaroo was actually on hand to help us with the grand opening. So that was a very exciting day for us. We partner with Bright Horizons, who have done a great job running our programs. The building is around 25,000 square foot and has 16 classrooms, one STEM room and one exercise room for appropriate age children to have movement, so to speak. Next slide.
Pardon me, I want to interrupt for a
Okay.
second. I'm laughing because I don't know who Captain Kangaroo
Oh,
is.
no.
So I lean over to Ben and I say, should I know who this is?
Oh.
So I'm not laughing at your presentation.
Yes, okay.
It's just the generational divide sometimes.
Did someone explain that to you?
No, feel free if you'd like to. Or I can Google
How
it.
to describe him? He was,
That is pretty sad.
yeah. That is like iconic, right? So well, he'd been around for many years before he passed, but kids kind of grew up with him on TV, and he was kind of doing the children's programs, and all the children looked to him as all-knowing, right? And he would have, basically daily programs on, and he'd wear a captain hat, and he was really cool. That's all I can say.
I will take your word for it. Thank you.
All right, sorry about that. All right, this is a facility map. I just wanted you all to have. Thank you for sharing that with her, Senator. She gets it now, right?
I still have no idea who he is, but I'm
All
taking
right.
your word for it.
All right. It was a pretty big deal back then. All right, this is a facility map of Toyota. I wanted to just give you some image of the size. We're 169 football fields in size. And you can see in the yellow, this is the area that represents our Child Care Development Center. And, the great thing about that and the proximity is it allows our team members to visit their children during their lunch if they choose to do that, which also gives them a little bit more peace of mind for those folks being close. Next slide. We currently have 179 children enrolled at our Child Development Center. We do have a wait list, about 88 children, and certainly our open position status of 9 teachers is contributing to that. We do struggle to find teachers interested in employment in this area. We really pride ourselves on maintaining low child-to-staff ratio to ensure the quality of care for these kids. And so that is part of our current challenge right now, to even be able to accommodate more families with child care needs. Next slide. And here are some of the highlights for our Child Development Center. And to the right, you can see some images of students doing their homework, and this is actually a sleep room on the right side. So again, we opened in January 93. Angie Looney is our center director and has been at the Toyota site for 25 years, so we're really proud of that and some consistency that comes with that. We have a 5-star rating since 2017. And we also created the first school-age sleep room in 2015 for nighttime care and weekend care. So when we have production on Saturdays, the child care center is open. We also have 5 staff that obtained early childhood credentials in the last 12 months. And Bright Horizons has a really great program that allows their employees to pursue education all the way into the bachelor's degree for free. And so that is definitely some good incentive, and it also helps their development as well. We're open 24 hours a day, 5 days a week, as I mentioned, 6 when we're in production. And this was the first child care center to reopen during pandemic closure, and we actually became the benchmark for our protocol that we put in place. We also offer busing. We bring school-age kids to and from school, and we do field trips for those school-age kids as well as community outreach programs. So we definitely try to engage all levels of the age groups that we support. This next slide, I wanted to give you also an image of our partnership with Bright Horizons and some of the programs we have. Toyota also offers support services for our team members, including free Sitter City membership to find and background check babysitters, nannies, caregivers, pet sitters, household help. We also provide 15 backup care days per calendar year for unexpected needs for our team members. We provide free college guidance from former college admission and financial aid officers. And we also provide special needs guidance from education experts. And finally, the Toyota program also provides education assist solutions with free personalized guidance from education and financial wellness coaches. And all of this is through the My Bright Horizons platform with access to all programs in one place. And while Toyota has the means to provide these programs, we know we're a big company, and there are many businesses in our supply chain that don't. And it takes just one missing part on our vehicles to impact our ability to produce. And so we're very conscious of that, and that's why we are here today advocating for early childhood child care development to support that future workforce as well. Next slide. And I wanted to show you all this image. Recently in April, Lieutenant Governor Coleman visited our site, and we're very excited to showcase our development center. We know, as a former teacher and mother, child care is a very important topic for her as well, and so she did spend quite a few hours touring the facility and asking questions, and definitely appreciative of her time to see what we're doing. And with that said, that completes my review, what I wanted to share with you today. I appreciate so much allowing me to share this program, and I'll turn it over to you, I guess.
Before we actually switch over, I think that Co-Chair Carroll has some questions for Toyota, if that's okay.
Absolutely.
I have lots of questions. Do you all get contacted very often from industry, large industry that's looking to move to the Commonwealth to ask about your model?
We don't get contacted often, probably through other sources, from that perspective. If we're talking specifically about the Child Care Development Center, as an example, just by our participating in the Kentucky Chamber activity, we were connected to our CVG counterparts up in Northern Kentucky, who we have a meeting with on Wednesday to share some of the child care development activity. So I think as we continue to maybe advertise it a little bit more, people become aware, and certainly they're interested to understand what works and what doesn't.
So with any Toyota facility within the country, does each one have a child care facility?
No, each one does not. We're actually rolling out 2 in the future. That one has been announced, one hasn't. I'll tell you just my example from coming from Texas, from San Antonio. I've spent 7 years in San Antonio. City is about 65% Hispanic, and what we heard from our team members is they depend on their families to take care of their children. Multi-generation living together, and we found that the child care center in that particular state and area of the country wasn't necessarily something that the team members were looking towards. But in general, we're looking at Mississippi, we're looking at Alabama right now. We have a child care center already in our Princeton, Indiana plant, but it's depending on the need and the projected usage as well.
And with Bright Horizons, do the staff at the child care center actually work for them, or do they work for Toyota?
Yeah, those staff members actually work for Bright Horizons, and our contract is with Bright Horizons.
Okay.
But we do have a team who has responsibility to ensure the program, the running of the programs, the building upkeep, all of those key points that ensure our quality of program.
Okay. So what did you all do when Toyota, when the plant was built? Was that was part of the initial plan, I'm assuming, to have that facility built to provide child care? And if so, what led Toyota to making that decision? Were there surveys done? Did you all feel that it was going to be a critical aspect of getting the workforce necessary, or what was the thought process?
I don't know that I can tell you specifically because our plant did open in 1988, 87, somewhere around that range. But shortly after, about 6 years later, we did build this facility, and we don't do anything at Toyota unless there's a need, and certainly that feedback coming from our team members said there was, especially second shift where there's not so many options for daycare outside the family. So definitely saw the need there and pursued it. It's still a bit challenging for our members, even at the price range we set to be competitive, with the other child care facilities and to offer the fair market value that's required. It is still quite costly, and certainly we are very cognizant about that. A lot of the programs that we've added on to our existing facility, if you will, are kind of in the background, and we haven't really passed those costs on to our team members just to keep that competitive rate.
Okay. And one more and I'll stop.
Yep.
The school-age sleep room, I run a center, and we operate very similar to the way you all do with all the services, but I've never heard of that. And is that is it just for school-age children whose parents work a late shift?
It's really especially focused on our second shift team members and their children. Now you could see probably, let me just reference back to that number. We have about 41 student or children on second shift right now, and you can see about 18 of them are preschool to school age. Of course, we have cribs and things of that nature for toddlers and so forth. So if they're part of the second shift, they are sleeping there as well. They're just not in that particular sleep room area.
And I think that's one of the areas that, I don't know that a lot of child care centers look at that, the overnight. I know we don't. And, being in Paducah, we have two large hospitals that I'm sure could benefit from another provider. So that's an interesting concept, and I like that.
Yeah, what we found when we looked around Georgetown and the areas, it wasn't available. And, second shift daycare and or night care, I guess it would be. And so we saw the need there, and, the parents obviously were conveying that need. And, certainly that's some peace of mind for folks, especially those single parents that don't necessarily have that support structure.
Yeah, and I'm going to have a question about the regulations for that in particular, for having that type of service, if those regulations are the same, but I'll wait till the end so Dr. Vanover can answer that question. That's all I have, Madam Chair. Thank you very much.
Representative Raymond?
Yes, thank you, Sandy. I was able to come on a tour with the Lieutenant Governor in April, and we just had our jaws open the entire time because we couldn't believe how fabulous the center was and the quality of it. And of course, we're both child care consumers. And you mentioned the pricing, right? And I won't say the number from my memory. If you have it handy, I'd love for you to tell folks what it's costing families. But I remember thinking it would have been 1.5 times that at the market rate. So I wanted to ask you a little bit more about it. How do you think about this sort of chicken and egg challenge of people need childcare to work, but you've got a wait list that's 80-something deep, and that's because you don't have the educators you need for those children. So there's the educators you need to hire, the workers you need to hire, and then the daycare slots you need. And it's I'm not sure which piece, it's a puzzle that's hard to solve. How do you think about that?
Yeah, and it's good to see you again as well. And I'm glad you enjoyed the visit. From the standpoint of, and can you just tell me the first part of your question? I got the child care to work, chicken and egg
The
piece.
chicken and egg. That's how you think through. Do we increase the number of slots so we can increase the number of
Gotcha.
employees, or we've hired the people,
Yeah.
but their children are on the wait list now, and we know that may lead to challenges with
That's
them
right.
reporting to work.
Yeah, and one of the things that I mentioned also that we do have kind of in the background, if you will, services available for our team members is that kind of emergency type child care link as well, so that they can reach out if they do have some type of challenge for child care. In general, about this wait, I don't like it. I don't like that 88 team members, kids, or 88 kids at least, are waiting to be part of the child care center. That tells me that the parents are probably juggling, struggling, handing off in the parking lot, doing some various things that we've seen parents have to do, especially on the second shift. But and it's a struggle right now because of the wage, of a competitive wage for these teachers. And I mean, you've seen fast food right now is offering up to $20 an hour, and to be competitive and still keep the rates that we're keeping is also a challenge. One thing that if you look at just one child for a week, it's around 160 to 180, depending on the age group, which is comparable to other child care facilities. My understanding from our staff is this is also a requirement of ERISA to offer fair market value for the child care cost to the team member. Because certainly we don't want our team members to be penalized through taxation or other means by offering like subsidies and that type of thing. So that is our dilemma, because certainly we are competitive, but just sitting back thinking, why can't we offer more? And those are some of the challenge points that we have. But I know Bright Horizons is working very hard to solve the teacher issue, but as Charles mentioned, 2 jobs, 1 person.
Right.
That's kind of where we are.
You mentioned that backup care option
Yes.
a couple of times. Would you tell us how that works for employees?
Yeah. So, and Charles, I don't know if you want to go to that slide, but it was around the Toyota Family Support Services, and we have a partnership with Bright Horizons that it's called Free Sitter City membership, and we offer 15 backup care days per calendar year for unexpected needs for parents. So these are like low cost. I think it was around $15 a child, to be able to get that sitter or that person to watch the child if for some reason you weren't in the child care center, or something unforeseen shut the child care center down, as an example. So we do have those types of services, and they're kind of bundled for our team members. And I want to show you kind of the brochure. It kind of looks like this. Toyota Family Support Services, and each of our team members has access to these types of programs so that they are educated and they understand what can I use, whether it's a child, whether it's elder care, whether it's a pet. I have lots of pets, so I'm very sensitive to that. But it's a bundled service opportunity for team members at sometimes free or low reduced cost. So it is kind of one of the tack-on programs that we have around the child care center.
To a benefit to employees.
That's
where they can get backup care for $15
That's
a
right.
day.
That's right. Yeah.
Great benefit.
And and we do that. We'll allow that 15 times during the year.
Yeah.
If they're not already in the child care center.
And then lastly, I wanted to ask you, so if the rate per week is about 160 to 180, knowing
Yeah.
what we learned last month about the margins, the razor-thin margins of child care centers, I don't know that price is covering the costs. So does
That's right.
Toyota invest additional amounts to run this center? How much is that? And then how do you all measure a return on your investment?
Yeah, that's a good question. We, I would say probably most of these services, are around $1 to $2 million additional a year that Toyota is investing just to cover these programs. It is not, an additional cost, as I mentioned. It is accessible for all team members when it comes to the brochure that I mentioned. Yeah, it is definitely, a challenge, for some families, some parents to be able to find the necessary means to be able to come to work, very simply. Even in my own family, I have nieces who are in single, parent situations. And, it's a little bit aggravating because they don't work, because it would cost more for their child care than to go to work. And so for me, it's a very sensitive subject, and that's one of the reasons why I wanted to come today, to really advocate for something to support these families to get folks back to work.
I appreciate that. Are you all looking at employee attrition every year, or how do you measure loyalty, longevity with the company? What factors are you looking at to show you that it's worth investing in the child care center?
I think the fact that we're maxed out right now, is one point. What we tend to do is, if we see that wait list is driven by space versus teacher availability, then we would look to expand. So we probably, if anybody knows Toyota, we love to measure everything, and our KPIs are very important to us. But just having that child care development center, we believe, is an advantage for us when it comes to hiring and retaining. We still are challenged, just like everyone else, with attrition and being able to backfill those positions. And it was very interesting. At the first of the year was the first time in our history where we didn't have a steady pool of employees to pull from to hire, and that is really unheard of for Toyota. But that is the situation when it comes to employee availability, and we do recognize that some of that is related to child care access. Okay.
Do you have any more questions, Representative Raymond? Okay, thanks. I want to wrap it up real quick so we can continue to move on to the Rockcastle Hospital. And if there are any additional follow-up questions, we'll save those to the end. Sandy, I was born in 1992, so that could explain why I did not know your reference. I will say that Senator Carroll and I are very partial to West Kentucky as well. Grayson County is the gateway to the West of Kentucky, and it's also a convenient bathroom stop. We're very, very appreciative of those tax dollars coming in to McDonald's and Storehouse Coffee. I really, as you're saying this, I love how Toyota is meeting people's needs. I think so many times, whether we're in government or private sector, we say, well, how can people meet our needs, rather than reaching out to them and saying, how can I meet your needs? And I love that you all are looking at that. Being raised by a single mom, especially, I think that, to me, you all are looking at the family dynamic is not what it was in the 1960s or 1970s. Things happen, and we don't have the nuclear family like we have always had. We've got grandparents raising kids. We've got single parents. And so thank you all for recognizing that for Kentucky workers. I really appreciate that. But I guess my big ask is, would you be willing to allow some of the legislative task force members on this committee to come to your all's facility, your child care facility, so we could see firsthand what that looks like? Because what you're saying is wonderful, and I think it would be really eye-opening for us. A lot of times in Frankfort, we don't get the opportunity to go out and see. And so I would love the opportunity for us to come to your facility to tour that. Not to put you on the spot, but also
anytime.
To put you on the
As
spot.
Representative Raymond knows, we're an open door, and anytime that you all would like to come visit, you're more than welcome. And
awesome. We will. I'll work with Charles on this and bring in Co-Chair Carroll and Ben Payne on that. So thank you for your presentation. All right, you're up next.
Thank you. To date myself, Miss Joyce, I went to Toyota when I was a junior in college, the first year that it opened, and we were all amazed at it. So good afternoon. I introduced myself a while ago. I'm so thankful to be here to talk about something that I'm very passionate about, which is quality early child care. My name is Twyla Burdette. I'm the director at Rockcastle Hospital Child Development Center, which is a part of Rockcastle Regional Hospital and Respiratory Care Center located in Mount Vernon, Kentucky. We are one of the largest ventilator units in the eastern part of the United States. We have 133 ventilator beds, 26 acute beds, and 4 ICU beds. Of those employees, we have 824 current employees at our hospital. 16 of those are at our child care center. We currently have about 110 job vacancies within the hospital itself. That is about 75% of that is clinical hands-on folks that we are missing from our workforce. So I'm going to tell you a little bit about how we came about and what started us to get us going. In December of 2008, the hospital decided to open our own child care center, and that's when we opened our doors. The opening of the center was the result of employee satisfaction surveys the last couple of years prior to opening. Since that time, we've moved once, and we increased our capacity as well as we built to suit. We are currently utilizing all of our space. We are licensed for 89 children. During the school year, we average around 62 to 65 kids a day. During the summer, we average around 52 to 55 children a day. We currently have 120 children enrolled. We serve children based on the hospital employee's work schedule, and they have to be a hospital employee to utilize us. The cost for our child care is based off the employee's salary and how much they make. So we're on a sliding scale fee for those that are on the lower income. They do not pay as much as those that are on the higher income. We currently serve children from 6 different counties. We're open 5 days a week, Monday through Friday. We open our doors at 6:30 a.m. and we close at 7:30 p.m. And that's to help utilize for the 12-hour shift coverage, mainly for our nurses and our respiratory care and our hands-on staff, as well as our SRNAs. Some of our challenges that I was asked to share with you guys are similar to Ms. Joyce's, of course. Some of ours is we have different children every day. So when I say that we have 120 kids, we aren't licensed for that many, and we're based off employees' work schedules. So we may have Jeremy from maintenance, and his child might be there 5 8-hour days. We may have Katie, who's a nurse, and we may have her child 3 12-hour days. We may have a x-ray technician 4 10s. We may have a child that's only there on Mondays because their mother or father works Saturday, Sunday, Monday, and we may only see that child 1 day a week. So last week, we had 85 different children that came through our doors, but we never exceeded 60 children a day. So that's to give you an idea of one of our challenges, of course, is obviously scheduling, children's records, keeping up with all that to make sure we are within licensure regulations and our STARS regulations and all that we have to entail. A couple of other challenges, obviously, is meeting the staff needs of the hospital. Those folks that have a rotating staff schedule, those folks that are trying to cover for a call-in due to sickness or something happened, and in order for them to get to work to cover for a call-in, they have to bring their children with them, which means that we need to see if we have space for those folks. So that's another one of our hurdles that we have. This is especially true for those that provide the hands-on care for our ventilator patients as well as our acute patients and our ICU patients. Trying to staff our child care center can also be a challenge as well. Planning ahead for next week's schedule, making sure that we're in ratio in each room as well as we plan accordingly. I'm going to ask him to share the next screen. Some of these are some of our parent testimonials that you have in your handout as well. I like to share a few of those that are not included up there. One of our dads that travels from Corbin, his comment was that he valued time spent in the car each day with his child. They were able to grab a lunch when he could, and he gets to see his world. His child gets to see dad's world. So there's no mystery to where the parent is. Both the child and parent have a peace of mind which is conducive to a positive emotional environment, and it eases the pathway to learning while they're in our care for that day or that week or that month or that summer or that year. Luca told his mom the other day that when they pulled up, he said, "Mommy, I'm so glad you work where I go to school." A nurse from Pulaski County, she has a 1-year-old. She sent me a text a couple weeks ago, and she said, "My son is surrounded by so much love with you people for 38 hours a week. I can't thank you all enough. Truly a huge part of what keeps me working here." So when you factor in and you talk about ROI and you talk about what cost and what we're doing, it truly is not about making money. You need to expect losses because you will have them, as we do most every year. The positives far outweigh the monetary loss. That too can be measured economically. The average cost to lose an employee is 1 times their year's salary. We don't want to lose them, we want to retain them. Try putting a dollar amount on employee retention. Some of the things we pride ourselves in is we're on campus, and that is very significant. We are right there. Parents can walk in with their child and they can leave with their child. It's that easy. We have many different parent activities throughout the year, and we try to utilize lunch breaks to do those, whether it's Thanksgiving lunch, family picnics, Mother's Day special activities, Father's Day special activities, so that way they could be incorporated within their work day and they not be taken away from their work. This way they don't lose time either. The value of that is there is no dollar amount. Our children can be seen on therapy on site, whether that's physical, OT, speech therapy, and they can do that while their parents are at work. When you have a new mother that's returning from work and she's able to come down and breastfeed her newborn on her breaks in our nursing room, that in and of itself is invaluable. When you talk about our return on investment, we lose money almost every year. Prior to the pandemic and our recent grant money, we would lose anywhere from $65,000 to $75,000 a year. But that's something that our hospital, for lack of better terms, eats the cost because it's valuable to them for those folks that they do not have a turnover rate and they do not have to supplement for. So if you have happy employees, you have happy children, and life is much better for all of us. Those parents do get to continue to create a bond while they're at work. The cost is minimal considering the value that is gained. So let's assume that we're all parents here. You can recognize value. You want to spend time with your children. You cannot put a price tag on that. Let's remember what Luca said. Aren't you lucky to work where mommy goes to, aren't you lucky to work where I get to go to school? So I saw Luca's mom this morning and I said, "Hey, is it all right if I share that quote?" after I'd already typed this up. And she said, "Oh, I love it. Yes." She said, "We got the biggest kick out of it." And then she proceeded to tell me thank you and how much she enjoyed both of her kids getting to come there. She travels from Madison County. So what questions do you have for me?
Co-Chair Carroll?
Thank you, Madam Chair. And I too see the value at the center that we run, and it's child care is one of the programs we have. We have programs for adults too, and being able to attract employees and having that on site is invaluable to us. What we've got to do as a state, it's the bill that we passed that will allow businesses to partner with the state and help. I think that's a great idea. I think what we've got to focus on is we've got to make it where it's mainstream for larger businesses, not just to help pay for child care, but to provide it, to have a center at that facility. That's our goal. That's what we've got to do as a state. We've got to expand the number of facilities. We can't just work on the demand. We've got to work on the supply. And the way you all set up, and I know Baptist Health does that. We have a large center in Paducah for Baptist Health Paducah, and they do a great job there, and it is invaluable. But I hope one of the things that comes out of this task force is to where we can start making it more mainstream for businesses to do that, and it's why we asked Economic Development to be here today. That when we talk to business and industry looking to come to the Commonwealth, that needs to be part of the conversation from day one. And it's going to take all of us to get to where we're at that point, because we can you can throw a lot of money at it, but it's not going to solve the problem. We have to have facilities open, and it has to come at all the different delivery models to make sure that it happens. One thing that I noticed for a question now, you all do not do overnight.
We do
for
not.
Question number one. Question number two, And even with Toyota also, I heard no mention of a PPAC, and that's for medically fragile kids, child care for medically fragile kids. Have you all ever considered that?
We have, simply because we are very blessed with the rehab services on site. We do have several children with special needs that we're able to accommodate. We have briefly looked into that, but honestly, workforce, as far as what we can provide, currently we don't think that we can do that.
That's a good point, and it is trying to compete to get nursing staff for those programs is extremely difficult. But that's another component for that population of kids that we need to expand those programs throughout the state also.
To reference, we did do a survey about 2 years after we were open to see if later evening care or weekend care was necessary, and there was very little response from that. And we're also very in a rural area that may have some play on that.
Okay. And I want to explore this sleep room concept a little bit more later on, and maybe I'm thinking too much into that than what it is, but still I want to, with Dr. Vanover at the end of this, talk about that more. That's all I've got. Thank you, Madam Chair.
Thank you. We are going to move on. I know that Kuna she has a time frame. She's got a flight to catch. So I want to send that over to her, and then we'll save any questions at the end. So please go on.
Thank you. And I'll keep it brief because my colleagues on the panel have already really, I think, done a great job of illustrating why the business community does care about childcare. But to give some context from the U.S. Chamber of Commerce Foundation, this is a topic we've been involved in for quite a number of years now, really launched in 2017 with the Workforce of Today, Workforce of Tomorrow report. And just a few points on that, there are 14 million families with young children currently participating in the workforce. So for those folks, this is really a pressing issue. And then also, even pre-pandemic, as Charles illustrated, we were not operating at full capacity, right? And so there are a lot of questions about that. Why is that? And so the Chamber Foundation has done a number of surveys to get a better idea of what is happening in the context of workforce participation and childcare. And we got feedback from working families that about 50% of them, 1 in 2, cite childcare as the reason that they exited the workforce. And when you look at women in particular, it's about 3/4. They say that childcare is the reason that they are not participating. And then as my co-panelists have mentioned too, the cost of replacing a worker can be up to 150% of that employee's salary. So what you're losing when you lose folks in the workforce is really quite pricey. And then one thing that really struck me is that Twyla and Sandy both talked about how having childcare on site, they both used the phrase peace of mind for families, right? There are a lot of breakdowns in childcare, even if you are lucky enough to be able to have access to affordable, high quality childcare, right? And so there's a lot of triaging sometimes daily. I have, my childcare is not available, so I need to figure out where to put my kid, right? That backup care from Toyota, that kind of a benefit is really helpful for working families. But in general, that instability and stress when there are breakdowns in childcare, that can also impact productivity, right? So having affordable, high quality, accessible childcare really is a key component of having a stable workforce. So that's our workforce of today. And then the workforce of tomorrow is really, about the research we know about early childhood development and what high quality looks like and how important it is to lay the groundwork in those early years when there's that rapid brain development period, so that kids really are set up for success in education, which we know leads to success in the workforce. So obviously the pandemic had a real impact on employment and on the childcare sector as well. And so when the foundation started doing surveys during the pandemic, specifically about childcare, we looked at what I think we call kind of the childcare equation. There are approximately 5 factors that really feed into how families make decisions around childcare. That's, what their work responsibilities are, their home environment, finances, obviously, options within the community, and then kind of that family, friend, and neighbor option as well, right? And so solving that equation is really important to solving the workforce needs, kind of on the micro level, right? Because that varies depending on geography, on industry, and so on and so forth. So we had employers coming to the foundation saying, what can we do to help? This essential care for essential workers brief was put together in the context of the pandemic, but it's really transferable outside of that context. And so we've identified some what we call quick wins in internal investments and community investments that employers can do to really help their workforce. So just very quickly, an example of a quick win would be flexible scheduling. An example of an internal investment might be a backup care benefit. And then community investments, so it can range anywhere from advocacy to, building public-private partnerships, and so on and so forth. But I do want to stress that all of these strategies, the broad range of strategies that employers can participate in before anyone goes to that step, the first step is really talking to employees, identifying what the real needs are, right? That is the critical first step. So I was asked to give a snapshot of what's happening at the federal level. I'm based in the DC area. So as you all, I'm sure know, the Child Care and Development Block Grant is the primary federal source, the federal source for child care funding. It goes to states in formula. You can see just by the numbers that the current funding levels just north of $6 billion annually. I do want to point out that there was a really large increase in the fiscal year 2018 appropriations bill, which was enacted a handful of years ago. But there's a kind of an upward trend, but not. I don't foresee any kind of major increases from the federal level. Part of the reason I'll go into in the next couple of slides is that there's some dissonance when it comes to funding. Democrats have been pushing for sweeping changes with very significant funding increases that would cover the cost and make childcare affordable for basically every family in the country, but it's a very expensive proposals. Republicans at the federal level have supported initiatives to build on the CCDBG, the existing structure, and at the authorizing level, support that program, but leave the funding to appropriators. But there's some dissonance there that has prohibited folks from working across the aisle this Congress. And so I just want to go into some of the proposals very briefly. So folks have probably heard of the Buildback Better Act. This is the Biden domestic agenda, and it included 2 proposed new entitlements, one a birth to 5 child care system, and the other universal pre-K for all 3 and 4-year-olds. It would provide a voucher. It would link the voucher amount to income. So families making up to 75% of state median income would be fully funded. And then there's a sliding scale that would cap at about 7% of annual income, and it would cap out at about 2% of state median income. Those numbers are kind of flexible because there have been various proposals, and so there's some wiggle room there. And then for universal pre-K, it would be a mixed delivery system, so not just school-based, but also pre-K in childcare settings and so on. But this is a very partisan proposal. The price tag is approximately $400 billion over 6 years. Again, that figure fluctuated based on the changes in the proposal. It's no longer on the table because of political will, just to keep it simpler. The other proposal, is a child care development block grant reauthorization. And I want to just point to, there are a number of similarities. This is the Republican proposal, so there is no funding attached to it, but there are some thematic similarities. The cap on CCDBG would be increased to 150% of state median income, making more families eligible. There would be a sliding scale for co-payments triggered at 75% of SMI. And again, mixed delivery systems are emphasized. Both proposals also look to support the workforce as well. But this proposal leaves funding decisions to appropriators, as I mentioned. Because there's so much daylight on the funding and really the scope of what the federal role is in childcare, these proposals have not been, neither one of them is particularly viable this Congress. But I do think that there is a bipartisan recognition that there are breakdowns in childcare that do need to be addressed. I will say, go ahead, that it's unlikely that this crisis will be solved at the federal level. And so that's why I think we at the foundation are really looking to support states in the work that they do, right? And this is why I'm sitting here with Charles today. We just recently established the Early Childhood and Business Advisory Council, and that's a partnership with the Bipartisan Policy Center. And what we're doing is we're looking at about 9 states and pulling together early childhood advocates and the business community so that they can work together to look at what their unique challenges are and what some potential solutions could be. So just a few snapshots of some exemplars that already exist. In 2021, we released an untapped potential report for Missouri that looks at the cost of breakdowns in childcare at that state level and found that it's about $1.3 billion per year in costs because of childcare breakdown, whether that's participation in the workforce, tax revenue, and so on and so forth. And that report was part of the reason that that at the state level, Missouri decided to establish a child care task force and to start promoting innovative solutions to child care through what they have right now is $20 million in funding to start seeding some of that work. In Michigan, they established a pilot that they call Try Share, which is a cost-sharing model for low-income working families. So families, business, and the state are putting funding together to cover the cost of childcare in a Try-Share model. And in Colorado, a ballot initiative was passed to fund universal pre-K, and what that looks like in Colorado is, I think that the end goal would be 10 hours a week of pre-K for, within a mixed delivery system. So again, that kind of giving the families options to send their kids to a school setting or a childcare or in-home childcare setting for up to 10 hours a week. And that would be targeted at 4-year-olds, so the year before kindergarten. And then, of course, Kentucky. I don't need to tell you all what you did, but just a few examples.
I'm going to close things out really quickly on this. I know we're running short on time, so what I'm going to do is I'm just going to mention some of these policy recommendations very quickly, and then I'm going to also sketch them out in a more detailed paper, which I will then send out to the full task force so you guys can have some of the details on these. But very, very quickly, in terms of things the Kentucky Chamber would recommend that this task force consider from a policy perspective, first, follow through on House Bill 499. This is a complicated piece of legislation. It's a new program. I really want to emphasize that we are carving out new territory with that bill. So it's a very innovative program. I think we're going to be learning a lot about it over the next 12 to 18 months. And what I'd really encourage legislators to do is to dig in and study it and make sure we get this thing as to the best possible form that we can get it as this program develops over time. There's numerous reporting mechanisms baked into that piece of legislation, and I think those reports are going to be really critical. So I just want to encourage the follow through on that legislation. CCAP, this is our primary subsidy program for childcare. I want to emphasize that this particular program is a very strong pro-workforce program. To be eligible for CCAP, you literally have to work. There's some exceptions to that, but this is part of that program. We have received a lot of additional federal dollars throughout COVID to support that program. Those dollars will go away, and it's going to be important that the state step in to try to fill some of those gaps, because this is important not only for working families, for employers, it's also very important for our providers who receive reimbursement rates through the CCAP program. Third, we need to take a close look at local zoning, something that we need to encourage localities to do, to examine how their local zoning ordinances may or may not prohibit the development or formation of childcare facilities in various parts of their jurisdiction. The city of Louisville did something similar with this, where they undertook a comprehensive study of their zoning code to ensure that there are certain places where if an employer wanted to say establish an on-site care facility, that there would be an option or a pathway to do that. I think that's something that we need to kind of think about in all zoning jurisdictions throughout the state to see how we can be helpful on that. Fourth, the Business Partnership Grants Program. This is a grant program to assist with the development of employer-led childcare. So, for example, on-site childcare solutions. This is something CHFS rolled out, I believe, last year. That is something that, again, I think we need to study very closely and see if there's a way to leverage that. These are dollars on the table that employers could potentially use to defray some of the cost of opening a childcare facility on their business. Similarly, at the federal level, there is a tax credit program called the Employer Provided Child Care Tax Credit. It's also sometimes known as the Facilities Tax Credit. This is a credit that businesses can take against their federal income tax liability associated with costs such as opening an on-site childcare, contracting childcare services, and also using childcare resource and referral agencies, so they can actually recoup some of those expenses through this tax credit program. It historically has not been a heavily used tax credit. I think that's going to change over time. Something we might consider in Kentucky is a state level equivalent to that tax credit program as a way to incentivize the formation of more on-site childcare. Finally, going back to the issue that we were facing with childcare workers, we do have a good tool in Kentucky to at least partially help with that program through the Early Childhood Development Scholarship. The General Assembly did fund that scholarship to about $8 million in the previous budget. That's something we're probably going to want to continue doing to support the formation of more early childhood professionals. So that's a good thing. At minimum, if we can defray the cost of education that it takes to be a high quality instructor, or at least receive those credentials, that's a good thing for the state and a good thing we can do to help that workforce. So with that, I think we've covered as much ground as we can, and I'll turn things back over to the chair.
Thank you. Thank you all so much for that presentation. I'm going to kick it off with two questions, and I know Representative Raymond and Co-Chair Carroll have questions as well. Twyla, thank you so much for your presentation. Once again, I think that you're meeting your workers' needs where they need to be. I think you're meeting them where they are, and I think that's really astounding for Kentucky companies to do that. So I appreciate that as well. Do you all partner with anyone for the Child Care Center, or do the employees, are they part of the Rock County or the Rockcastle Hospital?
They are part of the workforce of Rockcastle Regional Hospital and Respiratory Care Center. They are hospital employees when they become members of our team that provide child care.
Does the, so like we have Owensboro Health in Grayson County, and I'm on the foundation, the foundation. Does the foundation play a part in making sure that you all have funding for that, or does that come from the hospital's everyday expenses?
It comes from the hospital's everyday expenses. Anything that we have a deficit in, so to speak, the hospital just supplements that income.
Okay, awesome. And then I have a question for Charles. What does Missouri consider innovative solutions? Or that might be for Kuna.
In terms of what exactly they're doing, I mean, I think it's primarily task force driven, so I think they're kind of undergoing a similar process right now to study those.
Okay.
And there is some component of public-private partnerships as well.
Okay, awesome.
We could get more info on that for you.
Okay, thank you. And then I will give it over to Representative Raymond since she was patient. in holding her question.
Thank you all. I've appreciated how our employers and our chairs have both acknowledged how much value is in this space, and that value and cost in this area don't always line up. But the value's there. And we know that employers are going to be a huge part of solving this crisis in Kentucky and elsewhere. But I just wanted to raise a couple of worries that I have and see how you all approach them or deal with them. I worry about someone losing their job and their childcare at the same moment. That would be a double whammy that I think would make it nearly impossible to get back on steady footing. So we know that CCAP might be available to someone in that situation as they're searching, but that's not the same safety net as Medicaid, for example, in that situation. So I wanted to ask about this sort of childcare cliff that could be created if someone left their job.
We provide a 6-week grace period that if they were to be terminated or if they were to quit, they would have 6 weeks to find other means for childcare after they left us. So we would provide care for those folks.
Thank you.
I'll have to follow up on that one. I'm not sure if we do provide some in-between period before that child is moved, but certainly I think there is some pressure with the waiting list as well to get children in there. But let me follow up on that one.
Thank you. I appreciate it. And then I wanted to ask about, so you all both have adapted to the needs of your employees, and you've done surveys to see what the real needs are. I just wanted to name that I don't think childcare has evolved as quickly as work has evolved. And so some of the challenges that I've encountered in Louisville are folks expressing a need for drop-in and facing, regulatory barriers that prevent their providers from offering that sort of thing. And then can we meet folks where they need help in terms of hours, gig workers, folks who are just in different positions like this. But I hear that you all have been as adaptable as you can be. And then we've talked about workforce quite a bit today, and sort of separate from the workforce that is early childhood educators. And I imagine this task force will spend a lot more time on the pipeline of early childhood educators, but just wanted to sort of acknowledge that workforce. And I hope that we can explore the opportunity that could be created when we think about bringing folks into the workforce who could be in a childcare setting, who need care for their own children. Mm-hmm. If I've explained that. Charles, I think we could unlock a lot of women's potential that way.
Yeah, no, I agree with that. I do think you see a lot of providers that sort of bake that into their compensation model for a lot of their childcare workers. That's something I do think that is worth exploring, because that could potentially be a very powerful talent attraction and retention tool. But at the same time, from the provider perspective, I think we could have multiple providers tell you that's also a loss financially for them, because that's potentially filling a slot that could be filled by a paying parent. So that's a very difficult thing for a provider to offer. So some might not be able to do that. But I agree. I think that's an important place to look.
Thank you all.
Yeah, and I think you probably saw in our slides that Bright Horizons does allow their staff's children to stay there. So,
yeah. I also heard today, expect losses.
Yeah,
that's exclamation point.
Thank you all.
And my employees that do have children can bring their children at a reduced cost to our center for them to come to work.
Co-Chair Carroll?
Thank you, Madam Chair. And the losses, and that's people that are watching this, and I think that's at the base of this task force, and it is at the base of the structure issue that we have with childcare in the Commonwealth and everywhere. It's just not sustainable. Under the best of circumstances, it's not sustainable. And just from personal experience, our center, we have about 130 kids, inclusive child care. At our height with our PPAC, we've had about 43. Without the PPAC, the child care, early childhood education, we lose money every month. It never generates revenue. The model just simply can't work in the Commonwealth. So we've got that issue to deal with for providers in trying to create a model where people want to open child care facilities where they can sustain, where they can pay their staff. We've gone through various stages of increasing pay with some of the federal dollars that came in. We made a long-term commitment. We do 3, 5, 10-year increases. We pay more for degrees. So we've done all that. It is still impossible to get fully staffed. We just can't do it, and we're not alone in that area. So that's another component of it. The wages for staff in the workforce, and a lot of good things going on in those areas, but 4 basic levels that we've got to address through this task force, and we've got to come up with some answers. The Chamber's proposals, I think those are excellent. And before I stop, just quickly, I want to get into a couple of the issues that we talked about with Toyota. Did you all consider the model of Toyota operating the facility itself and being able to offer perhaps maybe better benefits that maybe would have helped staff that center? And I don't want to get into too deep here and put you on the spot, but that's probably could be the key to remaining fully staffed, is to be able to offer better benefits, better pay, and Toyota as a corporation could probably do that much better than Brightstar.
Probably for me, I don't know the answer to that, but my assumption is when we established that daycare development center that we were not the experts of managing child care facilities. And I think as a result, we partnered, with Bright Horizons, who have a national reputation and actually have, I believe, global locations as well, to provide the necessary benefits that we wanted to provide to our team members in a high quality way. So I don't know that for a fact, but typically that would be the approach we would take if we are not the experts in a particular area. But I hear you. I understand your point.
If I could, Senator Carroll, too, just to kind of add some light, and certainly not speaking on behalf of Toyota right now, but in other conversations I've had with employers, one factor influencing that decision is often a liability conversation. Because as the employer, especially if you're a large employer and you take on an on-site childcare center, you are opening yourself up to potential liability associated with running that center. I don't know how those contracts work when it comes to contracting out that service. If you own the facility, but then you have another service that essentially actually provides the care, who takes on that liability, who shares that? But I do know that is a factor that comes in shaping those conversations.
Okay. I guess I don't see the liability risk being that great from running a large center for 12 years now.
I think if you're a very, very large employer, oftentimes those large employers can be targeted for all sorts of issues related to liability. So I think that's where it comes in from the on-site perspective.
Okay. And I said Bright Horizons. I apologize. The final question, if we could just kind of close out this the school age sleep room, and this concept, and maybe I'm not it, and I know you could stay open 24/7 or whatever. I get that part of it, and I guess my question is, if you just offer a sleep room where it's not maybe all the other services in the regulations, Dr. Vanover, if you don't mind, could you come to the table, Madam Chair, if you're okay with that? How does that work if you just had a sleep room where kids would come in and sleep overnight, as far as staffing, all the other regulations that child care has to address? Is that something different, or would they just be looked at just like any other classroom with the same regulations?
Well, I can say that prior to Angie Looney, the current executive director of the Toyota Child Development Center, I was the executive director. So I have experience with the sleep room. You have to have a special permit as part of your license in order to have after-hour care. It's not something that happens automatically. Typical child care is like 6 a.m. to 6 p.m. or a little give and take on either side. But if you do overnight care, then there is an additional component to your license. There's also a part of the regulations that state no child may be in care for more than 16 hours at a time. Because with full-day child care, you risk a family that might be overwhelmed leaving their child there maybe for more than a day or things like that. So you have an amount of time that you have to make sure that the child is picked up. At Toyota, because there is mandatory overtime on days when production gets behind, it can at times come close to that margin if a family is working additional hours, and so you had to watch it. But I never had a family that went over that time slot. Other facilities like Baptist Health Hospital avoid that by having the parents tell them in advance what hours they will be there, and then they have to pick up and drop off at that time period. I will say that the sleep room does pose some additional complications. The room is lovely. It is beautiful. Bright Horizons designed it. They are into aesthetics. That whole center is gorgeous. And so it is a cozy place where kids come in, but there is no family who wants their child to sleep in a bed away from their home if they have any other options. And so you open the facility up for second and third shift. A place like Toyota or their other Bright Horizons facilities, they have over 1,000 facilities worldwide. At least they did prior to the pandemic. They may have closed some, but a lot of hospitals have a Bright Horizons facility where they partner with them, Johns Hopkins, different places where they attach that to the hospital and may have 24-hour care. And then, of course, Toyota has the Indiana facility and Kentucky. But even if you work second or third shift, if there is anybody who can stay with your child in their bed, they're going to take that option. So you open the facility and you attempt to staff it, and then you may have a very minimal number of children that take advantage of that because their parents want something different for them. Those kiddos that sleep there, they shower there, they put their PJs on, they have a snack before bedtime, they get up the next morning, they get ready for school, put their clothes on, and then Toyota will even put them on the bus and send those kids to school to make sure that they have everything they need while their parents are working. But that might not be what the family wants. You've heard both facilities say that you lose a great deal of money when you do on-site child care. And if you do 24-hour care, after doing the books at the Toyota facility, I can tell you that most of the loss happens second and third shift. You reduce your staff, but you still, and finding people to work second and third shift is very challenging. Third shift, you just have to find somebody who will stay awake in a dark room while everyone else is sleeping. And that's challenging within itself. Second shift work, I've sat through so many interviews trying to find people for those shifts. And some facilities will do a rate increase for those shifts to give them an extra bonus. But an extra 50 cents or $1 an hour doesn't always make it worth it to work those different hours or the Saturday hours that for a production Saturday. So it can be very challenging on the team to find those staff members that you really need to open that. But the sleep room is accessible. We have in-home family providers that do the same type of things and partner with businesses. But there are things, there's a little more liability that you have to think about as an employer because, that adult that is in that room is supervising those kids take showers at night, and it's a more intimate setting as they're getting them ready for bed and things like that. So most places that have 24-hour childcare have camera systems as well to make sure that the employee is not ever inappropriate or accused of being inappropriate if they didn't do anything inappropriate. So there's some balance there as well. Most of the people at the Toyota campus that work second or third shift are the spouses of somebody who is working second or third shift, and their spouse is already working those hours, so they try and line up with their spouse. But they may be new to the field of early childhood, and so there's a lot of initial training that goes into, there's a week of onboarding when they bring them on to help make sure that they're prepared for the job that they're doing.
And maybe just to give you some idea, second shift at Toyota is 5:15 to 2 a.m. Mm-hmm. And then max overtime would be 2 hours. So you're looking at that time frame for kind of a max situation for a child.
Yeah. The biggest regulatory issue that the Toyota facility has to worry about is when the first shift is ending and the second shift begins, because the first shift has overtime and second shift is coming in. Their max at the building, I think, is 183, maybe somewhere around there. But there's over, kind of like you were saying, there's over 200 plus kids enrolled because one is AM and one is PM. But during that time period where first shift could be working overtime and second shift is coming in, you have to make sure that those 2 hours of the day you have every staff member possible on hand to meet the ratios and to help children get out and get with their parents as quick as possible to not go over the capacity of the building. And they do a great job of that.
And Dr. Vanover, can you please introduce yourself for the record, just so we have that in the minutes?
I'm Dr. Sarah Vanover, and I am Policy and Research Director with Kentucky Youth Advocates.
Thank you. And then I'm going to let Senator Thomas ask a question, and then we are going to go ahead and wrap up this portion. If you all will please stay if there are any questions after CHFS presents, I would greatly appreciate that. Senator Thomas, the floor is yours.
Thank you, Madam Chairman. I have a question for Ms. Burdette and Ms. Knott. But before I ask my question, I want to go back to something that Representative Raymond said, and I want to direct this to you, Mr. All. I agree completely with what Representative Raymond said, that our economy is changing. That we're seeing a lot more gig workers now. That the gig economy is very real in this country, and you have a lot of people that do different jobs daily, and I think that is a major contributor as to why we continue to see this decline in the workforce here in America and in the state as well. So, you look like you want to respond to that.
Yeah, so gig workers are absolutely counted as part of our workforce participation rate. So when we look at those rates, gig workers are included in that. They would not be considered not working. Now, the way those surveys work is that Census Bureau and Bureau of Labor Statistics partner to do those surveys, and they ask them a standard set of questions. They don't ask them if you are employed in traditional employment. They don't ask if you are employed as a gig worker. They simply ask questions related to, are you working? Okay. So I would not point to the emergence of gig workers as an explanation for the decline in workforce participation.
Okay, well that's helpful for me to know. I appreciate you saying that. I'm big on pay, Ms. Knoll and Ms. Burdette. So I'm just curious, what do you pay your child care workers? Dr. Vanover mentioned that in her explanation. So I'm just curious, and I'll start with you, Ms. Knott, because your daycare center is a bit more urban. I mean, Georgetown is, pretty much right next to Lexington, very much part of an urban setting. What do you pay your daycare workers? And I'm sure that varies between infants as opposed to school-age children. And the same question for you, Ms. Burdette, as well. You're a bit more rural. I've been to
Yes.
Mount Vernon
Yes.
and Rockcastle County quite a bit. What do you pay your workers? I'm curious as to the answer to that question.
Yeah, as you mentioned, Senator Thomas, there is a range, if you will, depending on if they're like an admin support versus a teacher. And that range is between $14 and $16 an hour right now.
No less than 14, no more than 16?
I won't say no more than 16. Probably depends on what shift they're on and things of that nature. But on average, around in that range, so to speak.
Same question to you, Ms. Burdette?
No one starts under $12 an hour up to $14.50 to $15 an hour. And that's based on their experience and their education.
Okay. Thank you very much. Thank you, Madam Chair.
Thank you. We will go ahead. Thank you all so much. As I said, if you all don't care to take a seat, and stay for a few more minutes, just in case anyone else has additional questions, I would greatly appreciate it.
And for Representative Raymond, I did get an answer to your question about grace period, and unfortunately, no. When someone is terminated, that is the last day as well for the child.
Thank you.
As we start moving to CHFS, I do quickly, now that we have a quorum, I would like to ask for a motion to accept the minutes from last month. Can I get a second? All right. And all in favor say aye. Anyone oppose? Awesome. The approval of minutes have been approved. So last month we also briefly discussed House Bill 499, and our previous presenters did as well today, and the impact that it will have on child care. We've asked representatives from the Cabinet for Health and Family Services to come today and give us an update on the implementation of the Employee Child Care Assistance Partnership Program. If you can please introduce yourself, and just as a reminder to turn on your microphone when you speak, we would greatly appreciate it.
Good afternoon. My name is Lisa Dennis, and I am the Deputy Commissioner for the Department for Community-Based Services.
Hello, my name is Laura Began. I am a Staff Assistant Regulation Coordinator in the Department for Community-Based Services.
And I'm Katie Smith. I'm the Deputy Secretary of the Cabinet for Economic Development. We're here to support CHFS with this program.
Awesome.
Thank you for giving us the opportunity to present today. Before we really dive into House Bill 499, I want to provide some highlights of things going on in child care. The Division of Child Care is in the Department for Community-Based Services and offers lots of programs related to child care and for child care providers and families. Right now, we are distributing American Rescue Plan Act funds, supplemental payments. If you will recall, we were providing stabilization payments through the pandemic earlier. Now we have federal funding for supplemental payments. Those are currently being used to provide business partnership grants. You heard about that a little bit earlier. That's up to $100,000 in matching funds for businesses to establish child care centers. We also have other startup grants such as Child Care Desert grants, family child care grants. So we've been incentivizing the establishment of family child care homes. Those are typically smaller residential child care, usually with only a few children. We also are offering facility repair grants with that funding. And we have provided 410 child care teacher credentials, certifications. Before I get into more of House Bill 499, I wanted to talk a little bit about the Child Care Assistance Program, which you also heard referenced in the previous presentation, just to make sure everyone is aware of this program. It's administered by the department, and it is a public assistance program for eligible low-income working families in which their child care provider directly receives part or the entirety of the child's tuition cost from the department. So similar to many of the other public assistance programs administered by the cabinet, the provider is receiving the payment from the department. It's not actually going to the family or the child. So this goes to the child care provider in this instance. As of May 2022, there were 15,096 families enrolled in the Child Care Assistance Program, and this provides, again, partial or the entirety of child care tuition for 26,946 children. We also currently have over 1,600 providers participating in this program. So it's good for families, for kids, and for child care providers. It gives them a steady, dependable payment that they will receive each month. So on this slide, we're talking about recent changes in the Child Care Assistance Program. Last year, we made 2 changes that really assisted providers. In July of 2021, we used appropriated general funds that were established in House Bill 405 to provide a $2 per day per child rate increase to Child Care Assistance Program recipients, providers. And then in October of last year, we used federal funding to increase those rates again to the 80th percentile of current market rates. So last year, we saw 2 increases to the payments that providers receive. In January of this year, we increased the initial eligibility for the Child Care Assistance Program. It had been set at 160% federal poverty level for some time, and we increased that to 200%. In March of this year, we implemented a new program, a 3-month transitional period for households who have exceeded the income guidelines and are no longer eligible for the Child Care Assistance Program. So this lets families and children receive 50% of the assistance that they would get in the program for 3 months after exceeding that income threshold. So here we have the data that that has resulted from these changes. We will be submitting a report on this to the Legislative Research Commission by September 1, and we will also be presenting this information to the Benefits Cliff Task Force in September, but we wanted to share with you what we've seen already. So from expanding the eligibility from 160 to 200% from January 1st to June 30th, an additional 1,293 children have been able to receive partial or full tuition coverage for childcare. Since beginning the transitional exit period in March, 56 children have benefited from still receiving that half assistance that they were getting. We actually had information on this up until mid-July, and we were up to 80 children who were benefiting from that transitional period after exceeding income guidelines. We saw that the changes that we've made have had a really positive effect for families and providers. So we recently made further amendments using those federal funds. Effective July 1st, we increased eligibility again, this time from the 200% federal poverty level to 85% state median income according to the U.S. Census. These tables show what that income looks like. So, for example, a two-family household, so say a single parent and one child, would have previously been cut off from CCAP eligibility if they were making $2,903 a month. That is $34,836 annually. When we expanded that to the 85% SMI, that's now $3,743. So that would be an annual income of $44,916. So in this example of a single parent and a child, we've essentially allowed them to make an extra $10,000 before being ineligible for child care assistance. Another part of our most recent amendment is in September. We will be expanding the transitional period that I mentioned from 3 months to 6 months. So again, once a family becomes ineligible due to exceeding the income guidelines, they will still receive half of that assistance for 6 months. So you have information about, the Child Care Assistance Program providing part or the entirety of child care tuition. You may still be asking, what does that actually look like to someone's pocketbook? So here we've compiled the average cost of care for one child statewide. Now, this is only in licensed centers, so you will have smaller child care providers, such as in-home family child care centers, which might be registered or certified, usually residential, only caring for a few children, and they typically cost less. But 88% of our regulated providers in the state are licensed centers. So that's why we've provided this information. You see here that, as you've heard, the infant-toddler care is more expensive, with preschool and school-age child care costing less as the child gets older. Those child-to-adult, child-to-teacher ratios are allowed to increase. But it's still between $630 to $750 per child per month on average. Last month, you heard Dr. Vanover talk about when her children were little, her child care cost exceeded her mortgage payment. I'm also a working mom. In preparation for this, I went back and looked at receipts from when my children were little, and there was a point in time where I was paying $1,500 a month for child care. So I share that with you just to emphasize that child care is a major part of a working family's finances. It's also a huge benefit cliff. If you have a working family, especially with more than one small children who are on the Child Care Assistance Program, get a raise and they're now ineligible for the program, they may be paying $1,000, $2,000 more than they were when they were eligible for the program. So it's definitely a major decision point for working families. And this is where we get into House Bill 499 and the potential that it has to help families as well.
So, House Bill 499 creates a pilot program for an employee child care assistance partnership to incentivize employers to contribute to the child care cost of employees. The cost associated with child care on lower and middle class families is significant, making it one of the biggest benefit cliff issues that impact families. Partnerships like the Employee Child Care Assistance Program are vital to address barriers to accessing high-quality child care and helping the Commonwealth develop a strong and thriving economy. The employer's contribution for within House Bill 499 will be matched using state general funds established in a trust just for this program, and the match is dependent upon the employee's household income. The House Bill 499 implementation timeline, we've outlined a few of those, few major steps here. We will be developing and promulgating the new regulations, outlining the application, verification, and payment processes, and including a standardized contract for all participants. And then we'll begin accepting applications in April of 2023, and payments will begin being issued beginning in July of 2023. And we are also in the process of within the department, creating a new section within our division of child care that will work similarly to our CCAP program for administering of House Bill 499.
The bill is very thorough about what this program, how it's to be established and administered, but we thought it may be helpful to also talk to other states that have had similar programs so that we weren't entirely recreating the wheel. So with our federal contacts, coordinated a number of calls to other states and agencies that have had similar programs. The first peer-to-peer call that we had was with the state of Florida regarding their Florida Child Care Executive Partnership. This also started as a pilot in 2014. In 2019, it sunsetted and really morphed into a school readiness program, but it was funded with $15 million in federal funds. It created local partnership boards, and it required that they put in a 6% match, so that increased the funding of the program. And they encouraged other organizations to contribute to that pool of funding as well, such as United Way, Goodwill, and others. They really targeted families that were over that subsidy amount, so what would be the equivalent of our child care assistance program, families over 85% state median income. They matched dollar for dollar, and they had over 500 entities participate with over 17,000 children benefiting from their program.
We also did a peer-to-peer call with Wisconsin. They launched an employee child care assistance program they called Partner Up earlier this year. Their program was funded with a combination of federal funds that included ARPA funds, their preschool development grant funds, as well as CRISA funds. The Wisconsin program, they contracted for slots between businesses and providers, specifically for their employees. And that program also allowed for the opportunity for small businesses to complete a joint application to pool their resources and reserve slots, which gave them more flexibility to address openings. Businesses were required to contribute at least 25% of cost, but could contribute more, and then the state paid the remainder, and there were no costs to employees. Wisconsin shared the importance of marketing and getting information out regarding these types of programs. So they did a huge marketing campaign. They received over 600 applications from businesses throughout the state, and Wisconsin also prioritized the applications based upon small businesses, infant toddler care, child care deserts, and businesses who contributed a larger percentage than the 25% required. And also in Wisconsin, in preparation for implementation, they surveyed businesses around the state relating to their employees' child care needs and their perspectives on the importance of child care to their businesses, and they received over 1,000 responses, and 64 of those respondents indicated that child care was a valuable tool in recruitment of employees.
I'll just add that they were surprised as well that the number of businesses that thought that childcare had no impact to them.
Yeah, they were surprised it wasn't higher than
Right.
that.
At the time of preparing these slides, we had not yet had a call with Michigan, but we were able to have that at the end of last week. You heard in the previous presentation about their program called TriShare. It began in March of 2021. Again, each entity paid a third of the cost between the employer, employee, and the state. It targeted employees whose income exceeded the subsidy guidelines, but still struggled to afford childcare on their own. So specifically, this was households above 200% federal poverty level, but below 325% federal poverty level. This program was administered by the Michigan Women's Commission, which I thought was interesting. Of all the states that we talked to, they were all administered by different agencies and also all funded differently as well. They had 77 employers participating, representing 70 families. They concluded their pilot this year. The General Assembly included funding in the appropriation and directed for it to be a statewide program. So right now they're undergoing external evaluation of the program. Those results will be shared with partners as they talk about how to take the program from being administered by local hubs to being a statewide program. At this point, we are planning to have other calls with states and agencies across the country who have had similar programs. And we've been comparing the successes and lessons learned. I have really enjoyed the calls, and I always like to end by asking the administrators what lessons they've learned or what do they wish they had done differently. So I wanted to share some of those with you as well. One of them said to put a cap on how many slots each business, each employer could obtain, so you didn't have one large business benefiting the most from this program. They also said to distribute the funding regionally, considering labor statistics. So not all of the funding of this program would go to one or two large cities. For Wisconsin, you heard that they ranked their applications, which I also thought was very interesting. They put that ranking criteria on their website in advance so that businesses would know what they wanted to incentivize and prioritize. Some incentivize quality child care, such as providers participating in programs like our All-Stars program. And finally, Michigan, very interesting, they said that they found that their biggest obstacle was that their program was only a pilot. They said businesses were very reluctant to invest in the program, and if they didn't know for sure that the program was going to stay in existence and provide their share of the money continually. So I thought that was very interesting lessons learned.
So, future actions. We are in the preliminary stages of drafting new regulations and the contract, and we will be working very closely and collaborating with our stakeholders, including the Chamber and the Cabinet for Economic Development and other key stakeholders across the state. We are, as I mentioned earlier, creating a new section to perform administrative functions related to implementation and ongoing operations. And then a marketing campaign. We'll be working to develop a marketing campaign, including both internal and external strategies, and working again with our partners on what that looks like, developing materials, social media campaigns, as well as webinars, town halls, information on our websites, and other opportunities as well, because we have heard again the importance of getting the word out and spreading information about the new programs and the opportunities available for employers. And then employers and employees, and then, of course, making changes as needed and permitted through the regulatory process with our implementation plan beginning in spring and summer of 2023. And before we close, we just want to take a minute to acknowledge the importance of this program and others like it. Everyone here recognizes the importance of child care as an economic development tool, and child care is just that, but it's also so much more. The availability of affordable and quality child care contributes to the overall well-being of our communities within the Commonwealth. Nationally, we are learning more and more every day about the impacts of economic supports, such as child care, and how they contribute to the overall well-being of families and children. In a study completed by the American Academy of Pediatrics in November of 2021, it found that for each $1,000 states spent on benefit programs per persons living in poverty, there was an associated reduction of 4% in substantiated findings of child maltreatment. Child care was one of those economic supports identified within that study. And again, I mentioned that here again today just to highlight the importance of child care as an economic driver and support, but also an overall community well-being support for our families and children living in Kentucky. So with that, I'm going to pass it to Katie Smith.
Thank you. Yes, we're excited about this program. We're looking forward to collaborating with CHFS on it, and we really consider this kind of another tool that we'll be able to use in trying to market the state of Kentucky. We want to reach out to all of our existing employers, existing businesses, make sure they're aware of this program and how they can access it. And then also we'll use this when we're working with new locations and attractions of projects, so we could put it on the table as another tool that they can access. So we are going to be working, I think, a lot with marketing the program with CHFS.
Are there any questions?
I'm going to kick us off, and then if you all have any questions, please make sure that Ben sees it. As everyone in this room probably knows, I'm very partial to this bill, so thank you all for the presentation. I appreciate the update on it, and I would like to put the ball in your all's court. Charles All and I were talking earlier about a possible cleanup bill, so if there are questions, comments, or things that need to be cleaned up, please don't hesitate to reach out. Charles and I would both be happy to meet with you and Mandy Simpson behind you at Metro United Way. It is kind of our baby. It's our brainchild. And so we would be happy to work with you all on that. So please don't hesitate to reach out with any concerns on that. I think one of my biggest questions is for the when you're talking about creating a new division, I do have a little concern with that. The administrative costs are 5% the first year and 3% the second year. Have you all looked at also the consideration of having a third party administrate this? Because we did put language in there that would make it flexible. And I just say that just knowing the cost of what it is to hire a state employee with a pension and everything included. So I would just like to hear your all's thoughts on that of, what does a division look like to you all?
Well, it would be a section within our division of child care. So we already have the division established, and then we would create a smaller section of employees to administer the program, similarly to as we do with our CCAP program. So we already, and we can also, I think part of our process, our thoughts around that was we can also tap into other administrative supports that are already there within that division to help support that section. We did, and it's no final decision has been made just yet. We are considering all options, but the procurement process, we're concerned about getting something through and approved in a timely manner. So at this point, felt like it was probably our best option would be to build that in-house.
We do appreciate that. One of the states that we spoke to said they had 6% administrative costs, and it was definitely not enough, so we'd be happy to provide you with updates. We do plan on modeling it after our child care assistance program, so we will be happy to keep you updated on that. Thank you.
Thank you. Does anyone have any questions before we open it up to the full room of questions? And we've got like 10 minutes to wrap up. Chairman Carroll.
What will be the process to help educate the business community on this program?
So we are, like we mentioned, we are working on we'll be developing a marketing campaign, but again, webinars and town halls will be a big part of that to help educate the business community, and then again, partnering with our partners with the Chamber and with the Cabinet for Economic Development will be key strategies in getting their expertise.
So we've been talking about that as well. We're currently rolling out the Kentucky Product Development Initiative, thanks to you all, and this past session. And so we were talking about, we've got email addresses, contact information, so does the chamber. And so we'll likely, webinars, we did host a couple of webinars on that program on the 14th and the 21st of this month. And we've also talked about recording those webinars, creating a website so that if they can't participate, so we truly have already been kind of talking about planning for marketing the program, having a website, put the materials on there, and getting the word out in advance to the communities and businesses to let them know, hey, this is coming up. Let's see if we can participate, or if the businesses aren't able to participate, can they have somebody in the community participate, and then get them the information.
Okay. And in talking with the other states, is it their goal to eventually step away from the program as far as financial support and just create that environment where businesses, that's common practice for them to help cover child care?
Other states did do it differently, but the pool did increase enormously when they allowed others to contribute to it. So that definitely was an interesting part. They still contributed, though, and again, some with federal funds and some with general funds. Michigan, and going from their pilot to statewide, they requested and received a large appropriation to do so. So, states do it differently, but it seems to be pretty well received when you have multiple sources funding it.
Okay.
Thank you.
And I think this is a great program to help that segment of parents that fall within that range. But it still concerns me that we're creating more demand when we don't have the supply for what we have. And along those lines, with the grants that have been available to help open new child care facilities, do you all have any updated numbers on how many new facilities in the last few months?
I think it was 3 from that. From the
3 from the business
Yes,
partnership
partnership,
grant in 2 different counties. We have 15 for the Child Care Desert grants, 16 for the Family Child Care grant, and 16 for the Family Child Care grants in 8 different counties.
In addressing these and talking with these folks, what are you all beginning to recognize the greatest barriers to growing more facilities throughout the state? Have you seen any common themes from any of these folks who are considering or opening centers?
Yes, Michigan did cite that was another burden to them. I think it's 44% of their state is a child care desert. So just to remind everyone, that's a national term for an area that does not have enough child care per children based on population. Kentucky is about 50% child care desert. So they did cite that being a burden that they hadn't anticipated when they first started their program. So.
And then staffing is, of course, the common trend as well. That's what we heard.
Okay. I just think we have to be careful as we move forward with funding from the state that we balance it properly. It can't all go towards helping parents pay. It can't all go towards better pay for workers, and it can't all go towards subsidizing providers. So I think we have to be very careful of that balance to make sure that the money is spent properly, and whatever we decide. And I know there's going to be some ask at the end of this. So, that was the concern. I think the bill was a great idea, but I was just a little hesitant when we just don't have enough providers at this point to create more demand. So, I think that's really got to be a large part of the discussion, is that we invest in proper balance through those 3 areas. Thank you, Madam Chair.
Representative Raymond.
Yes, thank you. Katie, I was interested to hear you say that, House Bill 499 could be used to attract employers to Kentucky. I think you're right about that, but I think the money's going to get gobbled up by Kentucky employers we've got and used by Kentucky employees, which is great. So, Chairwoman, I think we're going to need another bucket. to attract some folks from out of state. And then, Katie, I also wanted to ask you if you know anything about a potential child care center going into the Ford Blue Oval plant.
Sorry. I am not for certain about that, so we can try and look into that and get some information back to you if that's okay.
Let's push on them if we could. Thank you.
I also have vested interest in that, so I would appreciate to be included on that as well. Katie, that is my new district, and that's been a big conversation.
I'll report back to the staff, and then they can share it with you all.
Any more questions from members? I'm going to wrap us up. I want to thank everyone for being at the tables today. Thank you all so much. We're just running short on time. So if there are questions, make sure to follow up with each other and ask any questions while we're all here in the room together. It just won't be televised on KET. I do want to say I'm very glad that the cabinet is here at the table. I know that there was a lot of concern and pushback during session. They did stay neutral on the bill, but there was a lot of concern of how it was going to happen. So I appreciate your all's changed attitude and being so willing to work on it. So thank you for doing that and coming to the table today. The next meeting of the task force will be Wednesday, August 24th, 2022 at 1 p.m. And I will take... I'm not going to ask for a motion for adjournment yet. Co-chair Carol has a question real quick.
Yeah, and Katie, I'm sorry. Something that a lot of thought has gone into, and I'm curious with the cabinet, how is this subject approached with new business and industry looking to locate? Is it common for the discussions with folks coming in, or what role does childcare play in the cabinet at this point?
So when we're working with companies on potential projects and locations or even expansions, there's a lot of different discussions we get into. We get into utilities, we get into workforce. So this could come up with workforce. It can also come up with quality of life. We were sharing about the education systems in those areas and communities, but we also, as part of that, we're also talking about the daycare systems and childcare systems available. So that is something we use when we're working to kind of pitch that community for a location. And also we work with our community partners that are, when they're presenting, to have them focus on things like that as well. So yes, this topic is, and a lot of our different meetings with site visits on projects that are either expanding or considering new locations here in Kentucky.
So how valuable do you feel a structured program in Kentucky that is established strictly for supporting these businesses, industry? How valuable do you think that will be or could be in recruiting these folks?
As I mentioned, I think it's another tool that we'll have in our toolbox to be able to share. I think it depends on the different companies. Some may be very attracted to it. Some, it may not go much into the discussion. A lot of times they base their decisions on their locations and their expansion projects on different things. We had one actually tell us that they came back to a community here in Kentucky for a surprise visit, didn't have us participate, and the deciding factor was when they actually got out of the car, the mayor and the local economic developers saw them outside the window, went out, greeted them, welcomed them, and they said that was their deciding factor, was that how friendly the community was in coming out. So there's so many different decisions that go into that, or factors that go into that decision. I do think that having this program available for businesses, again, is another tool for them to consider, because not many other states have this, and I think it will help us in competing for those projects.
Okay. I'm just trying to get a gauge on how, within the economic development world, how that has evolved in the last couple of years in relation to child care.
It's kind of the workforce, as we've heard mostly today. It's truly going to help open up the workforce and try and help get more people involved in the workforce. And that right now, if you talk to any of your businesses in your communities, I think that is their number one topic and point for discussion. And so I think we will try to use this as an advantage to try to help show that we could, if they will participate in this program, they could help expand and grow their workforce and make positions or make it more eligible for people to be able to participate in the workforce.
Do you all ever call in Health and Family Services to meet with a potential industry to go over
We do.
these issues?
We have been collaborating because we I think it was in 2021 we may have added hospitals as being eligible industries in our incentive programs, in some of our major incentive programs. And so we do call in CHFS to talk with them to say, is this a qualifying industry? You all also created the Rural Hospital Loan Program, and we already collaborate with CHFS on that program. So we do a lot of cross collaboration as it is with CHFS, especially because they're the expertise in this area. So whenever we have a potential project in the healthcare industry, we may reach out to talk to them about it.
Okay, thank you. Thank you, Madam Chair, and I apologize.
It's okay. Thank you. And Representative Raymond, I did a quick check, and you just have to work in Kentucky. You don't have to live in Kentucky, because we were trying to look at attracting people from border counties that work here and that could still utilize the program. So you just have to work in Kentucky to receive the House Bill 499 incentive. Okay, motion to adjourn. That was really slow for the Kentucky General Assembly. All right, our next meeting will be in August. Thank you very much.